Why don't we answer some of the questions that we have received from women?
Sounds good.
For example, Samantha from Pennsylvania asks, are there any concerns about having sex wearing the soft cup? And I really want to emphasize that the soft cup is very safe to wear during sexual activity, vaginal intercourse, but it is not a contraceptive, so it's not going to prevent pregnancy or sexually transmitted infections, but it's very comfortable to wear during sex. And we also suggest that they might want to use a fresh cup before they start sexual activity.
That's right. It's a very important point.
I have another question here asking, can my partner feel the soft cup during intercourse? And that's a very interesting question because usually no, but again, it may depend on the position of intercourse and it may depend on the couple themselves because each couple is different. We're all individuals. So you might have to want to experiment a little bit and try different positions, but usually it is not felt once it's in place by the partner.
Right, right. I have a question here from Melissa from Palmyra, Pennsylvania, and she asks, are there health risks using tampons versus soft cups? I feel that I'm doing my body harm when I use tampons because they absorb all the moisture and stick inside when you try to remove them. That's a very common question that we hear. And since the soft cup is non-absorbent, that is not an issue. And remember that it does not change the vaginal environment in regards to pH or bacterial flora, and may be safer than some of the other products available currently.
That's true.
Michelle from East Brunswick, New Jersey asks, how long can you use one cup safely? And the soft cup can be placed for up to 12 hours. And it is very safe and again has no association with toxic shock syndrome.
And then Channing asks, I know that tampons cannot, but can soft cups be used during postpartum recovery? And we advise that after pregnancy, you wait until your first postpartum visit with your doctor and let them give you the okay to start using soft cup again.
Correct. It's recommended that patient have at least 6 weeks of pelvic rest completely.
Yeah.
Some other questions that we've been asked are, how do you know if the soft cup is right for you? And that's an excellent question. Soft cup may not be right for everybody, but for the vast majority of women, it would be a very good option. If it is properly fit, you should not experience any discomfort or leakage. And sometimes if the flow is particularly heavy, you may need to change the soft cup more often than the 12 hours to minimize the leakage potential.
Good point. I have another question. Can I urinate or have a bowel movement while wearing the soft cup? And I think here it's really important for you to understand your anatomy. You urinate through the urethra, your bowel comes through the rectum, through the anus, and the vagina is separate. But there's a wonderful film on your anatomy on the website www.softcup.com.
Yeah, that's a great resource to refer to. Another question that I have is, can I insert the soft cup too far? And again, this goes back to the anatomy question. If you're familiar with the female anatomy, you know that it's basically a closed end. You can't go beyond the vagina. And so there's no place for the soft cup to go other than where it's supposed to.
Now, another question is, what if I have a tilted uterus or cervix? And many women do have a tilted uterus, but most of them can wear the soft cup. Again, it may not work for everyone, but for most women it does work.
Right, right. Another question I have here is, can I use a soft cup before my period to prevent an accident? And the answer is yes. Since soft cups can be worn for even your lightest days or even before you're anticipating your period coming, because it is safe, it can be placed for up to 12 hours, it is not a problem. It makes it a very good option for women who are having issues with spotting or irregular periods and prevent accidents.
Yes, very good point. Another question I have is about removal. And many women are concerned that they will be able to remove it very easily. And one thing that I tell women is to just relax.
Right.
Relax the pelvic floor muscles. Think about doing Kegel exercises and think of the relaxation and not the contraction of those muscles. Or even bear down a little bit as if you're having a bowel movement, what we call a Valsalva maneuver.
Right.
And it'll come out very, very easily. So relax, bear down a little bit, and you'll be able to just pull out the soft cup very, very easily.
Right. And sometimes they are concerned about the messiness of it
Yes.
with the removal. And, you know, like anything, it takes practice. So the more you do it, the easier and more convenient it will become. But to start off with, you might want to start using the soft cup on your light flow days, or maybe on a day that you're not even having your period, just to familiarize yourself with the technique to facilitate that.
And another question I have is, where can I buy soft cups? And they're available at most drugstores. And please go to the website, www.softcup.com, to locate a store nearest to you.
Great point.